Sarah confirming yes.
So I suppose, should we give a little bit of an introduction to this event first?
Please.
Go ahead there, Clara.
Okay, so we are members of Intersex Ireland, and the aim of this live stream is to focus on different aspects of intersex experiences, the intersex identity, and then hopefully at the end we'll have a couple of audience questions which we can address in a sort of panel format. So I'm just gonna, I suppose, go straight into a sort of introduction to what it actually, what is this word intersex, because I think we'd all agree on the panel that it's often so kind of in the shadows still, I suppose, that we really do have to start right at the beginning and explain who we are, what it means, and just, a real from A to Z. So there are 5 characteristics of sex, I suppose. Internal gonads, meaning, meaning testes and ovaries, external genitalia, chromosomes, hormones, and then secondary sex characteristics, which is things such as breast development, how hairy you are, that sort of thing. Intersex people have combinations of what are thought of as male and female biology. Intersex people can be born with external genitalia or gonads that don't fit in our stereotypical, or I suppose normal definitions of male or female, but it's far more common that there's no obvious external indication that a person is intersex, and that sort of blending of the male and the female is occurring only at the DNA level or at the hormonal level. So I think it's most common to be chromosomally intersex. That might sound like something that's very rare or very sort of unusual. It's not at all. The most commonly quoted statistic is 1.75% of the global population have these intersex characteristics. And this is usually discovered when an intersex person is born, when they go through puberty, when they are trying to conceive. It also might never be discovered, or might be discovered on an autopsy table, morbid as that sounds. Unfortunately, because, as I said, this is very in the shadows, this is incorrectly viewed as being something that's quite unusual. Intersex children in particular are at risk for medically unnecessary interventions and surgeries without their consent. And these medical interventions often cause physical and psychological harm. So in concrete terms, what are we talking about here, right? These interventions are very early interventions. The statistics tell us these are mostly happening before the age of 2. So implicitly, you cannot give consent when you are 2. Medically, unfortunately, we're talking things like gonadectomy, we're talking about clitorectomy, vaginoplasty, risks, including chronic pain, loss of sexual function, complications which require follow-up surgery throughout an intersex person's life, post-traumatic stress, gender dysphoria, depression, just to name a few. Statistics for incorrect assignment at birth of intersex people, leading to things like gender dysphoria, they're quoted as being as high as 60%. So why? I suppose in a word, queer antagonism has a lot to answer for in this sense. Western medicine defines functional genitalia as one that is able to facilitate heterosexual sex. A lot of intersex people's doctors make arguments to their parents when they're very young that are based on these cis-normative and heteronormative ideas, and that, you know, an intersex child will grow up very confused about their gender, confused about their sexuality, and often they sort of combine those outdated attitudes with inaccurate or at minimum unsubstantiated medical information, such as, you know, a very, very common one is saying that an intersex person who has undistended testes in their abdomen is better off having those removed in a gonadectomy, because otherwise they're at a very high risk for cancer, when we don't actually know that to be true for intersex people. And actually, by removing those, you are forcing that person to be reliant on medication to replace the hormones that those gonads were making for the rest of their life. You know, understandably, in a situation where a parent is being told by a doctor that their child is at risk in terms of their physical and their mental health, parents can also feel sort of coerced into giving their consent at these very young ages. When actually it would be far better for the intersex children that are in question here that it be delayed until they can make that decision for themselves as to what they do and don't need in terms of intervention, because often these variations don't require any intervention at all and are completely healthy. Often it goes so far as parents, you know, having these surgeries and sort of being so keen to hopefully create an easy life for this intersex child, they may not even tell the child that a quote unquote normalizing surgery has even occurred. Again, not one I usually have to explain when my audience is predominantly LGBTQ plus people, but intersex is different from gender or sexual orientation. Intersex people can have any gender identity, any sexual orientation, and it's also distinct from being transgender, although, as mentioned, there's a large overlap. Lots of intersex people identify as trans, and so it's very important that we ally with the trans community and that in turn they sort of ally with us. And it's just always a point that I make when I talk about this particular topic. So on that topic, how does one sort of be an ally? Educate yourself, learn about intersex from intersex people. Congratulations, you're doing it today. And use intersex inclusive language. I generally just give a catch-all that this is the same as using trans inclusive language. So it's things like not assuming pronouns and not gendering body parts, you know, as much as you can. Educate your community. Don't make the assumption that intersex is a medical condition. Include us in discussions about human rights, and remember that intersex bodies are not a way to win arguments about gender theory. We are not your go-to proof that there are more than two genders. Of course, there are more than two genders, but we're not your gotcha in that argument. We're far more complicated, and you know, it's a cheap argument, that one, I think. And especially I take issue with that if that's the only time you mention the existence of intersex people. It's far better to sort of, as I said, educate yourself. And when you do speak to our issues, come from a place of education, you know, ask us, platform us, and that sort of thing, rather than, as I say, trying to use it to win an argument. Just to pick up on one point here quickly, do not make the assumption that intersex is a medical condition. The reason I always point this out is that as I said, most people with intersex characteristics are perfectly healthy. They don't need any intervention, and they just can quite happily go along with their life. There are plenty of intersex characteristics which are stemming from an underlying medical issue. For example, myself, I have Turner syndrome, quote unquote Turner syndrome, which means I'm missing an entire chromosome. That causes me to have these intersex characteristics, but also certain other health issues. I view my health issues and my intersex characteristics as sort of two separate things. The underlying Turner syndrome, yes, is what causes me to have those physical health issues, but there's nothing wrong with my intersex traits, and they're not making me sick. So just to sort of explain that as best I can in limited time. So when speaking to intersex individuals, intersex may or may not be a part of their identity. Doctors don't often use the word intersex, as I've sort of alluded to. There is really highly medicalized language around intersex, and that's often what doctors will use. We're not really encouraged to use this to find sort of identity and community. There's still a lot of shame around this. So if you do meet someone who has, characteristics that fit this term intersex, but maybe they're not using that term intersex, maybe they're using this medicalized language, it may or may not be part of their identity, and that's okay. Everyone's sort of on their own journey there. It's not an intersex person's duty to discuss being intersex, at any time, at the drop of a hat. And we may not be comfortable discussing all aspects of being intersex with all people. Definitely there are aspects of being intersex that I only talk about with other intersex people. And I'm sure that's true of everyone on the panel today, because it's just, sometimes you can't share things when you feel they won't be sort of fully appreciated. Phrase your questions broadly, which is my sort of polite way of saying don't ask anything too, I suppose it covers me in the end, too stigmatizing, too fetishizing, too personal, something that you wouldn't ask a person who wasn't intersex about their own personal body, unless, of course, they want to share that with you. And so just very briefly, last slide from myself, some key goals. This is from the organization Intersex International. And I just thought they were a really good summary of, I suppose, what we as a community and as an intersex rights movement are trying to achieve. Full implementation of human rights, bodily integrity, and self-determination for intersex people. A legal prohibition of non-consensual medical and psychological treatment, because medical practitioners should not be treating intersex people to modify their sex characteristics unless that cannot be deferred for that person to provide informed consent. And that is in extremely rare circumstances. For example, somebody can't pass urine. That's obviously okay to intervene. Other than that, it should be deferred. Full protection against discrimination and the adoption of sex characteristics as a protective ground. We're not covered by sex and we're not covered by gender. So you do need to have this specific aspect under protected grounds, which is sex characteristics. And then just generally more education for society as a whole on intersex issues from a human rights perspective. So that's really all from me. That'll sort of cover a 101. I'm going to stop sharing and pass to the next person on the panel, and hopefully you all agree with me on what I've said. I haven't started any rows. And feel free to add to anything that I said, obviously.
Hi. No, I certainly wouldn't disagree with anything you said. My name's Sarah, and I was born in the early 1950s at a time when intersex was treated totally secretly. I was born with obvious ambiguous genitalia I had penoscrotal hypospadia. That means the urethra opened, at the base of what would have been my micropenis. I had a bifid scrotum, which means that it wasn't sealed. I basically had, labia rather than a scrotum, and I had a blind vagina, which means that I had a normal vagina that ended inside me an undescended testes. I had infant genital surgery at 18 months, which basically closed off all the female aspects of my genitalia. And until I started school, because I was registered for birth as a boy at my mommy's choice, I was actually basically living as a girl. And then I had to start school as a boy, which was a terrible time for me. And at that stage, I was still wearing female underwear, little girls, vests and knickers, which meant that I was bullied. My trousers were pulled down. I was made fun of in playgrounds, and basically picked on by, boys in higher classes. Age 11 to 12 was probably one of the worst years of my life. It's when others were having, which to them was their normal virilization or feminization. Unfortunately, I didn't, have a proper puberty at this stage. And I basically stayed the same at 14, 15 as I had been at 10, 11. I was seen as an effeminate male, bullied for being small, underdeveloped physically, and particularly in the genital area. I had no pubic hair. I had a very underdeveloped micropenis. So everybody sort of made fun of me. It meant also I had lots of social problems in relation to girls didn't see me as boyfriend material. They saw me basically as a gay boy. Um, and males, I couldn't bond with them because, what they wanted, was totally different from what I wanted in relationships or that. So in many ways, I turned to alcohol and recreational drugs as anesthetics to help numb this pain and kill, off the infant surgery. Eventually, I did start to have a mild form of male puberty, but it was incomplete. But, the problem was that I went through life being assigned male, but my body was physically more female than male. It meant that the first time I ever had any sort of assay at all by my doctor, he immediately put me on testosterone. And I went for almost 20 years, being injected with testosterone simply because it wasn't recognized that I'd been born intersex, that my physiology was more female than male. Because it said M on my birth certificate, everything in the medical profession was geared towards, confirming that, assignment at birth, was what I had to live. It often caused problems in that if I had a malady, I'd often be told, oh, it can't be that. It's only females have that, particular malady, or no. Those drugs don't react that way with males. They only react that way with females. I was refused by medical professionals to, to accept the fact that I was born intersex. Later, it turned out that I had partial androgen insensitivity syndrome. It also turned out that I was born with ovotestes, which means that I had both male and female gonads. What had to, caused the problem, with the very low male testosterone in my body was the fact that the one male gonad I had shut down, quite early in my life, and the elevated estrogen I had was coming from, the female gonad. But this wasn't accepted until a few years ago, which meant that I was fighting a losing battle against doctors, against surgeons, against that. But finally, they did accept, that this was a fact of life. But I have to point out that from a personal intersex, or as now quite commonly referred to as variations in sex characteristics, I've had quite a number of them all through my life, but they weren't readily accepted by the medical profession. They most certainly were not seen as normal in any shape or form. I feel that for intersex people to be accepted, we have to get the points across. That we have to be accepted as being a normal variation, just as some people are left-handed, some people are born deaf, some people are born blind. It doesn't mean that they're weird or abnormal. It just means that we're different in some ways from other people, but it's not to be made fun of. It's not an excuse to be bullied. And confirming what someone else, the previous speaker said, that many assume that an intersex person, particularly if they were assigned the wrong gender at birth, is a transgender and not an intersex person. And they then start treating you as though you have gender dysphoria rather than the fact that you're intersex. And what we have to do is we have to make the intersex or variations of sex characteristics much better known, an education program, and hopefully Olive will be carrying on with that, and Addy too. And what we need to do is to have it accepted, to have us accepted, and to stop the bullying, to stop making fun of children because they're intersex, and accepting them as adults. And that's all I would like to say for today. Thank you.
So, hi, I'm Addy Berry with Intersex Ireland. Some of the things I'm going to go over, because we didn't compare notes beforehand, I'm going to repeat some of the things that were said previously, but I think that's okay. So recently, the HSE told the United Nations Human Rights Council that it only operates on intersex children when they find that it's necessary. These same surgeries in particular were referred to as torture in 2013 by the United Nations Special Rapporteur on Torture. They're performed for what medical professionals have referred to as social emergencies, as there's no medical reason for them. On the HSE website, you can find a whole page on FGM, or female genital mutilation, which is described as unnecessary surgery on the genitals of a girl or a woman performed for cultural reasons. FGM is rightfully illegal in Ireland. The HSE, however, performs similar surgeries on intersex children in Ireland, and yet there is nothing on the HSE website about intersex surgeries or any of the 40 plus known intersex variations. Surgeons have justified procedures called hypospadias repairs in recent papers by saying they believe it's important for little boys to be able to pee standing up with their friends. This surgery involves rerouting the urethra so that it exits from the tip of the phallus rather than somewhere on the underside of the shaft. These surgeries have been associated with a wide variety of sexual and urinary difficulties, and recent studies have shown that those who've had these surgeries performed on them in childhood have a higher likelihood of ending up on disability in adulthood. Greece has recently succeeded in having unnecessary, harmful procedures performed on intersex children banned. For a very long time, I owned and I managed tattoo shops and piercing shops in both Florida and Texas. So when customers came in looking for genital piercings, they were warned about the risk of the loss of sensation or hypersensation. Intersex children get no such warning, of course, before being made to undergo procedures that are much more extreme than a genital piercing. There's evidence dating back to at least the 1700s that surgery such as clitorectomies, now referred to as clitoral reduction surgery, originated in attempts by medical professionals to prevent homosexuality. More recently, in the 1950s, the since discredited theories of a psychologist named Dr. John Money led to these procedures being performed worldwide. It was his theory that each and every one of us could have been raised successfully as either a boy or a girl. So when presented with an intersex child with ambiguous genitalia, doctors should choose whether the child will be a boy or a girl and then cement that decision with surgery. Many intersex children from that point forward were assigned female at birth because those surgeries were considered easier to perform. The saying used by medical professionals was, "It's easier to dig a hole than to build a pole." John Money believed these surgeries would guarantee acceptance by parents and therefore also guarantee a happy, normal childhood. What's interesting is that Dr. Money's own PhD dissertation found that intersex adults led perfectly happy lives for the most part without ever having surgery performed on their genitalia. In a 1968 book called Sex Errors of the Body, Dr. John Money claimed that the clitoris serves no purpose, so removing a clitoris that's deemed to be larger than what would be considered acceptable or usual would cause no harm, as he believed that all women received sexual gratification solely from penetration. He also believed that intersex people's medical history should be hidden from them so that they would enjoy a normal childhood with absolutely no idea that they were intersex. For a long time now, the measure of success of these early surgeries has been heterosexual marriage. So I myself am an intersex person that was operated on as a child, and I'm part of a European Commission funded research network called INYA, Intersex New Interdisciplinary Approaches, which looks at, it's across Europe, a research project that looks at different aspects of intersex, from activism to education. My research in particular looks at the experiences and needs of older intersex people across Europe. My research has found that for the most part, rather than guaranteeing acceptance by parents, many intersex children grow up rejected by their parents and sometimes also by their siblings. Many experience bullying in schools to the point of dropping out, which has repercussions for some for later financial security. For some, early childhood bullying follows some intersex people beyond school and into the workplace and their adult life. Many intersex people, of course, having their medical histories hidden from them, discover that they're intersex later in life. For some of the people I talk to, they experience rejection from communities that they were part of coming out as intersex, and that includes parts of the LGBTQIA+ community. Many people I spoke to have suffered pretty extreme isolation, with its beginnings in childhood. And this isolation has been exacerbated in the last couple of years by COVID and lockdown. While transgender and intersex are not the same thing, as we've mentioned, higher rates of Klinefelter syndrome, which is generally XXY chromosomes, have been found amongst transgender people. In a recent study showed that 34% of participants in a recent study of people with Klinefelter syndrome identified as something other than what was on their birth certificates. Many of the people I talked to for my research were assigned the wrong gender at birth, and some of those were medically forced through the wrong puberty under false pretenses. When the decision was made to hide our histories from us, medical knowledge around intersex bodies beyond infancy also ground to a halt for the most part. Almost every single person I spoke to described having a lot of difficulty finding medical professionals with any knowledge of intersex bodies, but they did encounter a lot of arrogance and rudeness and being talked down to as though the doctor was an expert, even when they seemed to have no intersex expertise or knowledge, ignoring a lifetime of lived experience that didn't line up with binary medical expectations of what might be considered a male or female body. Some people I spoke to talked about avoiding medical settings based on distrust, poor treatment, and memories of medical abuse and objectification. Mental health supports are very badly needed for intersex people, and therapists have been described as life-saving and positively life-changing. But finding good therapists is a luxury that not everyone can afford, and finding a therapist qualified to tackle intersex trauma can be like finding a needle in a haystack. A lot of the intersex people I spoke to coped with the cards they'd been dealt by pouring themselves into art. I talked to actors, playwrights, novelists, artists, and musicians during my research. Many spoke about the joy of finding intersex community, finding other intersex people with experiences similar to theirs, but there's barriers to intersex community rooted in medical dishonesty and secrecy. I've talked to people who didn't find out that they're part of an international vibrant community until their 80s. To finish, I would like to ask each and every single person listening to start having conversations with people you know. Educate yourself on intersex if you have time. You can look at our website, intersexireland.org, which has some information and resources on it. As well as greed amongst a small number of endocrinologists and urologists, it's also been the lack of intersex awareness amongst the general public that has allowed these barbaric practices to continue to be performed on us. Thank you. Over to you, Olive.
Thanks, Addie. I am Olive Wilson. HSC desperately needs to provide accurate, unbiased information to babies, to parents of babies with intersex conditions. We've listened to the other speakers and we know the long-term consequences of surgery. And yet parents are not being provided with the information that's going to have horrific long-term consequences. Site having an awareness made of, they were aware. That's the difference between the parents, unfortunately, and the 2019, I went to a conference in Zagreb. That's there, and it was where I met parents. It was organized by OII, and I met parents of intersex children. And they almost all said that the reason that they didn't get surgery on their babies was that they were aware. They may have known somebody in their families or a friend who was dealing with the awful after effects of the surgery. This is available to all. It's not good enough. You may have a friend or you may not, and you may be aware, because the long-term implications are horrific. Forward and work in their best interests. Sorry, do I go ahead or? At present, intersex people are invisible. Sorry, could we stop this, please?